Welcome back. Today we are going to discuss the link between care gaps and panel size, your clinic's panel size, which is the number of patients you are providing care for under a particular insurance. All right. So closing care gaps, it not only affects the incentive, closing care gaps serves another very important purpose. So if your clinic is consistently closing care gaps, they will definitely see an increase in their panel size, right? And today we are going to show you with a real example that how consistently closing care gaps, it increases your panel. So let's discuss a little bit about panel so that no one is confused here. So when I say panel size, I am talking about the number of members that an insurance attributes to your clinic or your provider. If you have ever downloaded a panel report or a care gap list from an insurance portal, right, then that list is your panel. All right. We are basically talking about the primary care practices. A dental works a little bit different. So just so that we are on the same page. So the idea is that when we talk about closing care gaps, most clinics are under the impression that, okay, we are earning incentive, and so they are waiting for the incentive only. This is one of the practice that I work for. And I was getting asked every week about, hey, where is my incentive? How much I have earned so far? And I had no option but to give this look. The point that I'm trying to make here is that clinics are really good at tracking incentives, right? Because, you know, it's a business, right? We have to know how much we have earned. Anyways, but what we are not tracking in our practices, in our clinics, is what is our panel looking like for this month? Or how has the panel changed? Whether it's staying constant, is it increasing, is it decreasing? And what is the denominator looking like? So basically, it is the denominator, it is the total number of patients who are eligible to receive a specific screening or the meter, specific criteria, right? So I will show you in a moment what I mean by that. This is a sample practice. And at a given time, they had only earned $40 under this care gap measure called depression screening. If you can see this current rate and what it reads after that, it says 8 out of 287 total members in compliance. So basically 287 here is the denominator. When the clinic had not closed any care gaps or they were performing very few screenings, they only addressed 8 patients for this measure called depression screening. They had 287 members. But over time, as the clinic started performing those screenings, what happened is that, are you ready for that? So as the clinic started performing more depression screenings, not only their incentive increased from $40 to $1,000, you can also see that now the clinic has a total of 308 total members that are eligible to receive depression screening. So the clinic, it moved from 287 to 308 members, right? Let me show you another measure. This is the same practice, right? Initially, the clinic had a total of 18 members that they had to address for this measure called controlling high blood pressure. And we can see that at this point, the clinic has not started earning anything. They have addressed 14 members so far. And they have not yet hit the, target where they can start earning from that measure, right? So as we started doing supplementals, giving them the proof that, hey, clinic has already done a good job on this measure, Now you can see what happened. Not only they were able to earn the incentive, which is from $0 to over $3,000, but notice this thing, which is 53 total members. So what happened? What happened to this measure is that earlier the clinic had to address 18 members, but now after they started showing some performance on this measure, they now had a total of 53 members. So this is actually an indication of panel growth, right? So why this is happening? Why the insurance is doing that, right? Obviously, if your clinic is consistently performing screenings or doing what they are supposed to do in terms of patient care, then your practice becomes a low risk practice for the insurance because you are performing the screenings, you are completing the screenings, which is resulting in better health outcomes. And so your practice becomes more safe in terms of attributions. So attributing members to your practice becomes safer because members are getting the care that they need. You are performing the screenings that you are supposed to perform. It is like, the insurance is sitting in their conference room and they are like, hey, this practice ABC, it is performing this screening really well. So let's send them more and more and more members under a particular measure. So this is the practical takeaway from today's session, that closing care gaps will definitely result in better health outcomes, incentive growth, but it will also grow your panel, which is leading to long-term stability. Because when the insurance is assigning more patients to your practice, then you have a chance to build trust with them, to show that you genuinely care for their health needs. So this is your chance to build long-term potential for your clinic. So if you want to understand how to read these signals in your data, in your care gap data, I have covered auditing care gaps and pair meetings in earlier sessions. And I have basically provided a training, a 4-part series training on how to close care gaps, which I will link on the top of this video as well, so you can check it out. And in the next video, we will discuss another important topic related to care gaps and how to improve health outcomes for your patients. Until then, stay tuned.